advance. I guess you just
Well,
move
it's a
this
pleasure
forward.
to be here.
I began my journey in sleep almost 40 years ago when I was a master's student at York University, looking for some kind of topic that I could sink my teeth into and that would be meaningful for me. And I started on the path of looking at sleep as an important clinical issue. And and I don't regret that decision. I've learned a lot about sleep in the past 40 years. And I hope to share some of the tidbits that help in promoting sleep across the talk that I'm going to do today. I started at Toronto Rehab almost 11 years ago and was surprised to see that there was very little on sleep as a important clinical issue in cardiac rehab. And I was lucky enough to be asked to write part of the guidelines for the Canadian Association for Cardiac Rehab and introduced sleep, the screening for sleep, as well as recommendations for treatment of sleep disorders into the current guidelines almost 10 years ago. And since that guideline was written, there have been other things that have been written that you may be more aware of. So I did a Google search on sleep and doctor, and this came up. Stephen King apparently wrote a book, a thriller called Dr. Sleep. So this is not recommended to help you sleep. But there is another guy who calls himself the sleep doctor, Michael Bruce, who recently published The Power of When, which is, I think, a wonderful book and very helpful in many ways. And of course, many of you may be familiar with Arianna Huffington, who wrote the book The Sleep Revolution, because she herself struggled with sleep and collapsed literally in her office and decided enough is enough and we better do something about it. So what I'm going to update you on is after we wrote the guidelines, and to my knowledge, we talk about health innovation here, that those were the first national guidelines anywhere in the world that introduced sleep into guidelines for cardiac rehab. This past November, the American Heart Association actually put out this scientific statement basically reiterating or extolling the value of treating sleep disorders, screening regularly for sleep problems, and developing brief interventions. And that's what I've been doing in the last 10 years, is helping patients sleep better. And we'll get to the program that I've developed before the end of this talk. What I want to get across to all of you is that sleep is a skill. Okay? This is something you can get better at. It's not a biological given. And this is best illustrated in this slide, where at the very bottom you will see at birth how all of us, when we came into the world, were sleeping. And it's kind of an on again, off again, on again, off again pattern where you're awake for a little while, then you run out of steam, you go to sleep. And that is, if there's anything that's a biological rhythm, that's what we were born with. But across our lifetime, we developed to the top tier of this slide, the adult pattern of sleep, which in most cases is a block of sleep of 7 or more hours a night. And there's many, I guess, tools that we have at our disposal that help us in this journey. So I'm going to talk about the on switch, starting the day, and the off switch, ending the day and going into sleep, and some of the biological tools that you have that help you in actually sleeping better. There are 3 main tools that I wanted to bring to your attention. Light is probably the most powerful tool in terms of setting sleep-wake rhythms, and the presence of light in the morning, and in particular in the first half hour after you wake up, is hugely important. I'll illustrate how the brain accomplishes that in a second. The second important thing is the sympathetic nervous system, or your autonomic system. And if your autonomic system is working well, then it is underscoring, or it is promoting a sleep-wake rhythm that is sustainable and that is reliable. And when that underlying autonomic system breaks down, then you are going to have problems with sleep. The other important element in this is food, because how and when we eat also is going to impact our sleep-wake rhythms. And for example, in North America, we're in the habit of having our biggest meal at the end of the day, which is probably one of the worst things you can do for sleep, because it's a bit like fueling up the gas tank before you want to turn off the car. It's not generally good timing. Now, in terms of light, the eye has in it cells that pick up whether there's a bright light around us or not. And that signal goes into the brain to basically help us encode or set our biological clock, which is in the suprachiasmatic nucleus. And that then sets off a cascade of reactions that tell the body when to wake up and be active and when to sleep. And on the right panel here, you'll see that your alertness level across the day is not a constant. It, in fact, goes up and down. And when you wake up, you're actually not at full tilt, so to speak. It takes a couple of hours for you physiologically to get up to speed. And of course, Starbucks and Tim Hortons do a great job of marketing that you need a coffee if you're waking up and feeling groggy. But in fact, that's kind of normal. And of course, at nighttime, then that should slow down and help you get to sleep. Underlying this, I said a healthy autonomic system, and what this slide illustrates is your cortisol levels. Cortisol is one of the main stress hormones your body produces, and you see on the left panel a younger person, on the right panel an older person, and you'll see how strikingly similar these patterns of secretion of cortisol is. So when we get it right and we have a good sleep-wake rhythm, this is what you'll see. And later I'll show you a slide of what happens in insomnia. But you'll see across the day, actually when you wake up, your cortisol levels are at the highest levels that they're going to be across the day, which means, that's partly why we wake up in the morning and don't hibernate. But it also means that you want to be careful in terms of how you start your day. It's a great time to sit down and plan your day, to figure out what's most important, and even to do some things that are calming or relaxing, going out for a walk or doing breathing exercises or anything of that nature. And across the day, in a normal and well-adjusted person, the levels of cortisol continue to go down because you probably need less and less triggers in terms of activation and doing things. And by the time you're ready to go to sleep, those levels should be at the lowest level across the 24 hours. So that's starting the day and kicking off the day. Now, the end of the day is a little bit trickier because we do have an internal switch that does help us kind of calm the brain down. That off switch is, I would say, largely overwhelmed these days by all of the different inputs we have from our environment, whether it's cell phones or surfing the web, electric lights, all kinds of things that were never around when this system was designed biologically in our bodies. So we have a legacy system that was designed 20,000 years ago or more, and we're living in the middle of a great big party, if you will, and it's really hard for that system to function well. There is a sleep urge. I'll show you a slide indicating what happens with it across the day. Melatonin is released as soon as it's dark, and that's one of the signals for the brain and body to slow down. We also want to make every effort to have a safe environment to sleep in, cool, dark, free of distractions and things that can wake us up. And your brain is very, very good at picking up distractions and reacting by waking you up. It's very important to let go of your activities, or to, so to speak, take your foot off the gas pedal So one of the things that I teach patients in the program that I run is winding down. You have to set up some kind of a system that works for you to actually wind down, to let go of all of the activities that you've been doing. And there is a rest and restore system called the parasympathetic system that has to be in charge by the time you go to sleep, because that's what slows the body down, slows your metabolism, and allows you to get into a deep sleep. Now, when you look at the combination of your biological sleep drive, that's the blue line, the sleep need, and that sort of goes up as you, the longer you're up. And it's combined with your circadian rhythm, the alertness feature that I discussed earlier. And what you see is there's 2 times of the day that we have a larger sleep urge. One's 2 in the morning, one's 2 in the afternoon. And there are certainly many societies, I'm thinking the Mediterraneans, who take siestas, who have sleeps around 2 in the afternoon. So that's a normal pattern. It doesn't have to be a single 7-hour block of sleep. Now, if any of you have had any sleep problems and had to go to a sleep lab, you'll know that they wire you up from top of the head to the tip of the toe, and they collect information. And I think calling it a sleep lab and doing a sleep test is maybe a misnomer, because they don't really care if you sleep or you don't sleep. They just care about what biological rhythms and activities your body is engaged in as you're supposed to be sleeping. And what we see on the left panel here is that your brain goes from alpha rhythms, which are very active brain patterns, right down to the bottom here where we have the delta waves, the large sort of C waves. And what that indicates is the brain is getting to a place where it's very relaxed, very calm. It has let go of the world, and it's in kind of idle. And that's how it restores itself. Now, in many sleep disorders, that deeper sleep pattern is missing. And if you categorize what happens with the brain across the night, you get this hypnogram, which shows you that a normal person starts off being awake, and then they drop down into a kind of light sleep, stage 1, a kind of a middle level of sleep, stage 2, and then a deeper sleep, stage 3. Used to be 3 and 4, but basically that's where you get those delta waves, those nice rolling ocean waves. And that cycle is terminated or ended by a REM sleep period, rapid eye movement sleep. That's where we're usually dreaming. And that cycle is about 90 to 100 minutes long. And after that first cycle of 90 to 100 minutes, you go through a second cycle, and then a third, and so on. At the end of each of those cycles, though, the brain is ready to wake up. And it's, I suppose, because we lived in caves and there were predators around us, that we began to be aware of the importance of tuning into the environment periodically. So what you see here is the top panel is sleep in children, the middle young adults, and the lower panel the older people. And you see most of the features of those sleep cycles are retained, but as we get older, there's more of a tendency to wake up in the middle of the night. And that's normal. Your sleep is lighter, your body temperature is a little higher, and it isn't a problem for your sleep unless you stay up for a long time. And that's what's illustrated in this slide. So on the top, you see that normal pattern of deep sleep where your body releases growth hormone and really helps to rebuild the brain's and body's readiness to wake up in the morning and get going and have a really successful day. On the bottom panel, you see what happens in insomnia, that the person goes into the sleep lab, and look, it takes almost 2 hours before they even start to get into a light sleep. And then they kind of bump around between a light sleep and waking up again, and then a middle sleep and waking up, and then having a REM period in the middle of that chaos. And you see it kind of bumps back and forth. It's very fragmented and choppy. And that's what creates that sense for the person that their sleep was unrefreshing, because it isn't really under the control of the parasympathetic system. That's the rest and digest. You're not getting the deep sleep, and you're not getting those those nice rhythms. So this is a comparison of people with insomnia, which is the dark line, with a normal population. And you'll see this is the cortisol levels. You'll recall the slide I showed you earlier, that for normal people, you notice the cortisol levels get right down to the bottom when it's sleep time. Whereas for insomniacs, you notice that the cortisol levels actually start to rise at about 8 o'clock at night. So they're anticipating trouble, and you can see it in what their stress system is doing. And in really bad insomniacs, it's worse. So you see that's the circles that are unfilled. So cortisol levels are important. But the other thing that happens is for insomniacs, there are problems with their immune system. So on the left panel here is the levels of interleukin-6 across the day and night, and you see that for the insomniacs, the levels of interleukin from about midday to about sleep time are high. And one of the consequences of interleukin-6 is feeling fatigued, feeling sick, feeling tired. So many insomniacs will tell you that I just don't feel good, but I can't sleep either. The same with TNF-alpha, which is another of your immune molecules. So bottom line, all of these things are integrated into the sleep pattern. And when your sleep pattern gets tossed out the window, it's usually because the underlying autonomic system, the cortisol production, all of these things is in high gear. We call that hyperarousal. And it's the hyperarousal that prevents you from falling asleep, and it also prevents the underlying rhythms of restoration to kick in and to make you feel like you're recharged by the time you wake up. So if your patterns of sleep have been disturbed, in this slide, the short sleep could be because of insomnia, or you're just not sleeping enough hours in the night, that creates changes in the body. It changes inflammatory reactions, it changes metabolic functions, vascular and hormonal functions. So all of those things are different if your sleep pattern is not a regular, predictable pattern. And that in turn carries over into increased risk factors, which themselves are not the endpoints that we look at in medicine of having a heart attack or a stroke, but kind of set you up for that down the road. So those risk factors include high blood pressure, obesity, diabetes, high cholesterol. And of course, as those risk factors persist and get worse, then the inevitable outcomes will happen. So there are many, many consequences of poor sleep, and I'm just highlighting the insomnia picture. Later on we'll hear about sleep apnea, which is even more insidious and has many more effects on your sleep-wake rhythm as well as your health. But you can see on the left panel here that there's many effects of poor sleep, from cognitive difficulties, focusing your attention, solving problems, wanting to interact with peers, etc. So all of these things bode well or bode poorly for health. And what I wanted to highlight is that sleep may be a common underlying factor in many of the medical conditions that we treat. So this is data from the US in the Medicare system. So Medicare is for people 65 and older. And what it illustrates is that, let's say somebody has come into the doctor and billed Medicare for, let's say, depression, okay? And so that's one of their primary complaints. So in their data bank, they were able to look at, is this person only depressed, or do they have other underlying problems? And what you see is that the red bar indicates that that patient may have one or two other medical conditions. The green bar, 3 or 4 other conditions, and the other color, whatever that is, 5 or more. And what you see is that it's rare for most of the patients that we treat, and I work in cardiac rehab, most of the patients I see come in with multiple health challenges. And I think that sleep-wake rhythms are a very important underlying mechanism to helping them with all of those underlying conditions. To look at what is the implication of this hyperarousal and the underlying autonomic disturbance. This is the conclusions from Basta et al. They wrote a paper on chronic insomnia and the stress system, and they highlighted that insomnia is not a state of sleep loss. So if we just focus on sleep loss, we're missing the more important picture. It is a disorder of hyperarousal that's present both during the night and the daytime. And they added any kind of therapeutic approach to insomnia should reduce the overall emotional and physiological hyperarousal and its underlying factors present throughout the 24 hours. And that's really what I've been working on at Cardiac Rehab. And the program that I put together really is targeting the underlying autonomic system, not sleep loss alone. Now I want to illustrate for you how early this kicks in, this autonomic reaction. So this is a kind of illustration of how babies up to 6 months of age sleep. And what you see is they may wake up at 6 at night, 9, or just before they go to bed. And this is a child who can sleep for a little while between, say, 11 and 3 a.m., so almost 4 hours, but then they wake up. Now here's the very interesting thing, is at 6 months of age, a child develops what Piaget called object permanence. Now object permanence means that if you show them a toy and you move the toy behind a pillow or something where they can't see it, so before they have object permanence, once it's out of sight, it's gone. Okay? It doesn't exist anymore. Once they developed object permanence, they know the toy exists. So if you move it behind the pillow, they will look for it. They will look because they know that that thing exists and has a place or is a object in space. The same with mom and dad. So it applies to parents. So if you put the child to sleep and you rock them and they fall asleep in your arms, and now they've developed object permanence, it means in the middle of the night when they wake up and mom isn't there, okay, now the stress system kicks in. They don't feel safe. And what you see is sleep patterns kind of break down in the evening because many parents will rock their babies to sleep instead of getting them close to sleep, then setting them down and allowing the baby to get to sleep on their own. Then they've gone to sleep without mom being there. If they wake up, they have a better chance of putting themselves to sleep during the night. So what this illustrates is the importance from a very early age of our sense of safety. We need a sense of safety to function effectively. And in fact, Stephen Porges talked about 3 levels of the autonomic system. And it's the middle level, the danger level, that causes the sympathetic arousal, fight or flight, to kick in. And that's what these babies would be experiencing when they wake up and don't see mom. It's a bit like you going to sleep at night in your bed and waking up in the middle of the night on the driveway, right? You wouldn't be very happy, right? You'd be pretty upset. So that's going to cause that fight or flight reaction from at a very early age. So what we're trying to do in therapy, as well as raising kids, is to create sense of safety. And when we do that, that helps to balance the underlying sympathetic and parasympathetic systems. And those are, in fact, the principles that I've incorporated into the treatment programs that I provide. And this comes from Porges's stressing that the autonomic system does support health. It supports growth and restoration of physical and mental functions. But it's only when it is not recruited for defense. So as soon as that sympathetic system is in charge, you're in trouble. Okay? Sleep is not going to be restorative. So in terms of interventions, highlighting a sense of safety for the patient and having the patient set up for themselves a reliable sleep environment that is free of distractions or anything that would pull them back into their day-to-day activities is really important. We use breathing as one of our, let's say, therapeutic techniques. So we teach patients how to do diaphragmatic breathing, and that has the advantage of helping them to actually slow their autonomic system down. And if you do that in the evening before going to bed, if you take 30 to 40 minutes to wind down, to kind of slow your body and brain down, then you're going to have a better chance at getting to sleep and having a better night of sleep. We also introduce mind-body interventions, things like progressive muscle relaxation, very important. We also introduce meditation and imagery exercises as ways that the patient can modulate their own levels of sympathetic arousal. And this approach is different from the traditional CBTI approach, and I don't have any difficulties with the CBTI approach. I use it regularly, but the features of the CBTI approach that I use are ones that are basically supporting the underlying neuromodulation or calming the nervous system down, not just reducing sleep loss. So this is a picture of our manual, and then these are the specific skills that we teach people, and we encourage them to practice these things for half an hour a day. And many times when they go through this process, they find it works. It helps them to get to sleep and to stay asleep. Now, I want to finish up my talk by preparing you for the two speakers after me, because they're going to focus on sleep apnea, which I think is a killer. It is, compared to insomnia, which is bad for your health and well-being, sleep apnea is far worse for many, many reasons. It will cause problems such as heart disease, heart attack, stroke, diabetes, obesity, you name it. So there's lots and lots of morbidity or associated medical conditions, and as well, increased risk of death. So if you need any reason to care about sleep apnea, this is it, and this is published about 10 years ago in The Lancet, and it shows the red line, which are people diagnosed with apnea, did not use CPAP, did not actually treat their underlying apnea in any way, and you see that about 1 in 6 died within 12 years, compared to the cohorts that were using their sleep apnea machines, the CPAP, and that's the blue line. So less than a third of those people died compared to the ones that were diagnosed but not treated. So overall, I wanted to stress that this is what we all want to achieve, right? This is where we want to get to, is where at the end of the day, we feel calm, we feel relaxed. We can put aside whatever activities we have day to day and set our mind to a journey of sleeping well. And to do that, you have to put everything away, including your mind, okay? So I use the metaphor of boots with people in the program. So we know, I think all of us here probably have a good set of boots that we use. We're Canadians, right? So we know that that has a great value in the wintertime, right? If it's snowing, if it's raining, you put your boots on, okay? You don't want to use your boots if you're going swimming in the pool, right? Anybody do that? No, we don't, because it's not helpful. You probably end up at the bottom of the pool. So thinking is just like that. At night, when you turn the light off and you lie down in bed, okay, thinking is like wearing boots into the pool. It's going to sink you. It's not going to help you sleep. It's going to make things more difficult. So we teach strategies for how to let go of those thoughts, how to not think, as it were, until the morning. So with that, I finished with my kind of brief introduction of sleep and why it matters. Thank you.